today's topic, neuropathy, and as we said on all of our little promos, if you've got burning, tingling, numbness, got neuropathy. So if you know anybody who's experiencing this, please grab them right now so they can watch this, or they can also watch the recording. We're going to go ahead and get started. So I am Lori Rappy from Thrive Functional Wellness Center. And
I'm Dr. Rappy from Thrive Functional Wellness Center.
And welcome everybody.
Welcome.
Today we are talking about neuropathy.
Neuropathy!
We're going to do a deep dive into neuropathy, and I believe that the doctor is going to start with his disclaimer.
Disclaimer, this presentation is for informational purposes only. The information is not a substitute for medical advice from your medical doctor. This information is not meant to prevent, diagnose, treat, cure any health conditions, and if you are concerned about your health condition, please discuss this with your medical doctor or visit your local ER.
Okay, now that we got that out of the way, we are going to answer some different questions and do a little deep dive into neuropathy. So I'm going to let the doctor just start talking about neuropathy.
Neuropathy. Peripheral neuropathy is what we normally hear referred to as. You can hear polyneuropathy. Poly means many and all that kind of stuff. But peripheral means this. Peripheral neuropathy, we'll use the word neuropathy. It's the same thing. So the nervous system is made up of two components. We've got the central nervous system, the brain and the spinal cord, and then the peripheral nervous system is the nerves that extend out from the spinal cord into the extremities, the arms and the legs, the hands and the feet, the fingers and the toes. That would be our peripheral nervous system. So peripheral neuropathy would obviously be damage or any type of injury or disease that's causing dysfunction of the peripheral nerves. Dysfunction of the peripheral nerves. So there's an underlying cause that's creating dysfunction in the peripheral nerves, and your medical doctor will say that you've got peripheral neuropathy.
Okay, that's a really good explanation. And sometimes they know you have neuropathy and sometimes you don't. So this will be really great information. So can you tell us a little bit about how many people have neuropathy?
So let me read statistics because I don't memorize those.
Okay.
So 25 to 30% of the U.S. population will be affected by a neuropathy at some point in their life. That's a pretty big number.
That's a lot.
60 to 70% of people with diabetes or insulin resistance will experience neuropathy. Huge.
That's huge. And just to stop there for a minute, I feel like a lot of people make that connection when you say between diabetes and neuropathy, but it's not the only source.
Yes, but also you have to remember, you can have pre-diabetes and neuropathy. Don't go, well, I don't have diabetes, so it must not be what it is. There's lots of different causes.
Right.
There's a large percentage of them. I think 30% of neuropathy out there is related to insulin resistance or diabetes, pre-diabetes. 30% is a pretty big number. There's a large percentage that they don't know, idiopathic unknown. And so they're not sure what it is. So the last stat here is 30 to 40% of people who receive chemotherapy develop neuropathy. It's chemo-induced neuropathy. It's probably the most difficult cases that we've seen have been with chemotherapy-induced neuropathy. Really great results. During my presentations in the office, I used to put up on my slide presentation a letter from Cancer Centers of America, and they talked about using some of the latest technology that we use, and they were able to get patients off of their pain meds, and they had I believe it was almost a 90% success rate doing similar protocols to ours. We've just fine-tuned ours more toward the general public, but we work with people who've got chemotherapy-induced neuropathy all the time. So that's just some statistics of the people out there with it.
And if you visit our website, which is thrivefunctionalwellnesscenter.com, we have a whole section of testimonials on neuropathy. And we actually have a few people who were kind enough to go on and do a little video about their chemo-induced neuropathy and the great results that they got. And how frustrating, right? You're going through chemo and you have enough side effects, and here you go, here's another one.
Right,
and
neuropathy.
Yeah. So let's talk a little bit about how long does it take to develop?
How long does it take to develop?
What's the process?
That's a great question. It really depends on a couple things. One, it depends on the nerves that are affected, and then it also depends on the underlying cause. So, but the vast majority of people out there, what they'll experience is some symptomologies in their feet or their upper extremities and fingers. They'll blow it off. My feet are numb or get tingly, and I blow it off. And then a couple weeks later, a month later, it happens again. Then I blow it off.
Right.
I don't really associate with anything because the frequency is very minimal. But what they'll notice over time is they'll start to experience it more frequent, and eventually it'll become frequent enough they'll go, hey, I think something's going on in my feet. And so they'll continue to experience it, and eventually it'll become constant. And at that point, they'll have full-blown neuropathy, and they may go to their doctor and say, you know, my feet are numb. And of course, the next thing we're going to talk about is the medical model. So again, it depends on the nerves involved, which we test for, and we'll get into testing. And it depends on the underlying cause. And we talked just a second ago about having prediabetes and diabetes as a primary cause of neuropathy. And so we can't just go, well, let me fix the numbness in your feet. We've got to address the underlying cause, which is insulin resistance, prediabetes, and type 2 diabetes with medications.
Yeah, and that goes back to literally what we talk about every single week about how our body is connected.
What's the underlying cause?
Right.
Key, functional medicine. What's the underlying cause? So that's kind of how long it takes to develop. It's a little different for everybody, but everybody that has neuropathy will really, if they think back, they'll all express the same thing. It was off and on, then it kept getting more frequent, and eventually it was constant.
Right.
See, it's a progressive disease.
It's progressive.
It progressively gets worse.
Yes, and that's the key. And so often we're so disconnected with our body, and a lot of the work that we do in the office is helping people reconnect with their body. And all of a sudden they're like, wait a sec, which I actually want you to kind of list the symptoms, to list through the symptoms, because it's important that if you're experiencing any of these, that you should get tested. So will you tell us
get evaluated? So we've got numbness, we've got tingling, prickling. Okay, there's that one. There's burning pain. Sometimes it's sharp electrical shocks.
Yeah.
We see that a lot. Let's see, what else do we got? Balance issues. That leaves loss of proprioception is balance issues. Cramping, which happens. It's not as often, but cramping does happen. What was the last one on the list there? Oh, sleeping issues. So it's not that the neuropathy makes it so I can't sleep up here. What happens is my feet hurt, my feet are burning, they're tingling, they're prickly, they're numb, they're on fire. I put the sheets over my feet and it hurts to touch my feet. Yeah. That's what keeps me awake. It's not the neuropathy making me I can't sleep. It's the symptomologies make it difficult for me to sleep. So those are classic symptoms that we see in the office. And I have allergies, so let me step out for a second. I'm back in. So you don't have to have all of those. You don't sit there and go, well, I don't have all of those, so I must not have it. You can have one. You might be the person that gets these electrical shocks. You might be the person that says, wow, are my feet numb? Like, this is an example. Somebody would say, scary. My feet were numb. And I thought it was the new shoes that I bought because I've been doing the bump and grind, and I noticed that my feet are numb, so it must be the shoes. It's not the shoes or socks. Right. It's neuropathy. And so those are the typical symptoms that we see in the office.
Yeah, we see that a lot, and I just want to comment on the tingling, and those are things that you can connect with. The numbness piece, that is really the piece that, doctor will talk afterwards about the testing that we do. But when people realize that their feet are numb, because they're numb, so you really don't know how numb they are until you do the test. And how dangerous is that?
Dangerous.
We know the falls, the balance issues.
Falls are huge.
You break your hip, you miss the step on the curb is something that we see all the time too. So there's a lot.
Falls are big. We had a gentleman that come in, this was a few years ago, he came in to see us. He came to one of our talks. He scheduled an appointment. He came in and he filled out his paperwork, and I was in there, and he had widower on his paperwork, and I thought, oh, it just about broke my heart. So I was asking him, and he brought up the fact that his wife had neuropathy, and it was really bad, and that she had gone to her primary care doctor, and he gave her one of the most common drugs, which made it so she couldn't feel her feet at all. And she was on one of those little step stools in the kitchen putting dishes away, and she couldn't feel her feet. So when she stepped back, she didn't feel the step. She fell, she hit her head and died on the floor in his kitchen.
Horrible.
So he presented like, okay, so my wife died, and I've got neuropathy. You've got to help me.
Yeah.
And so falls are a big deal, including with that. I think I read the statistic is 86,000 amputations every year that are related to neuropathy.
Well, that's
Lots,
a lot.
a lot.
That's a lot.
Yeah.
So you have one of these symptoms. Most people then go to their medical doctor. What exactly does the medical model offer for neuropathy? Let's talk about this.
Yeah, so we know the medical model. God bless them. They're there if you absolutely need it. But in our opinion, they overreach a lot, you know. It's all about prescribing a drug to minimize your symptoms. And that's what they do. They hear you say, I have numbness and tingling, Dr. So-and-so, and I can't feel my feet. He goes, oh, well, without any testing, he says, you've got peripheral neuropathy. Here, he gives them Lyrica or gabapentin, right? That's his solution. That's in his wheelhouse. That's what he knows what to do. He doesn't know anything else. And so it's important to understand that peripheral neuropathy is progressive, so we can stop the progression and reverse it, but that's not what they do. They give drugs to minimize your symptoms. And so he'll prescribe you that. We see it all the time.
Right.
I'll say, what did you do? Have you seen anybody? Oh, I saw my doctor and he gave me gabapentin. So really, gabapentin and Lyrica were originally designed for what? Seizures. Right?
Oh, wow.
Seizure drugs, seizure medication. And they're using it because it literally doesn't allow you to feel what's going on in your feet. It stops the signaling. So
Yeah,
of course you
that's
don't
okay.
feel your feet. But if I can't feel my feet, that's going to be related to my inability to walk or ambulate.
Yeah.
Okay? Proprioception means the ability for my feet to send signals or communicate with my brain, and it tells me, what am I walking on? Is this a flat surface? Is it uneven? Is it cement? Is it grass? Is it gravel? Is it sand? What is it? It's constantly, your feet are constantly telling us and giving us feedback to our brain.
Right.
So as their neuropathy progresses, they go from normal ambulation till they'll start to look down at the ground in front of them. They'll shorten their gait pattern. Eventually they'll slide their feet, because when they pick a foot up and put it down, they can't feel the ground. It feels like they're stepping into a hole,
Wow.
which means falling down.
Right.
So there's falls. So they'll get their medication, and then when they come to us, they're like, this stuff doesn't work. It makes me feel weird. I don't like it, and whatnot. So that's the solution you're going to get at your medical doctor's office.
And they're also the first to say, there's nothing you can do
Yes,
about
there
it.
is no cure. There's nothing you can
there's
do,
nothing
and that's
you can
not
do.
true. We know that. It's in the literature.
Right.
Okay.
There are things that can be done.
Yes.
And so if you hear nothing else that we've said today, that's a really important piece.
We
there
can work
are
with it.
things that we can do to address it.
Correct.
So that's
And
why
that-
I said at the beginning, if you have this or you have a loved one who has it, they need this information.
Correct.
It's very important.
The National Institute of Health says that you can regenerate nerves that have not died, and that's kind of what we're talking about. If you can regenerate and rejuvenate, revitalize, bring these nerves back to their normal capacity,
Right.
that's what we're talking about, okay?
So along that line, so we talked a little bit about you go to the doctor, what the medical model can offer. Now we want to talk a little bit about what we do different, because we always like to end with hope, with the idea that there's holistic solutions. And so let's talk a little bit about what we do differently.
What do we do differently?
Everything. Yeah.
Well, there's quite a few things. Actually, what we do differently is this, is we're going to do testing on you. We've got a 16-point neurological evaluation that was developed over years to identify what amount or percentage of nerve loss you have.
Right.
My experience of 32 years in private practice working with thousands of people that had neuropathy, it's really come down to this. If I do a test on you, the test we're talking about, if we do that testing and I've identified that you have less than 85% nerve loss, there's a huge percent chance you're going to be successful dealing with your neuropathy. Our numbers are in the 90% success range.
Yeah,
it's because
really
we choose people that we know we can help. If you're above the 85% chance, for most people, I would say we're not going to reverse this, but we can stop the progression. But I'm just going to tell you right now, your feet are going to feel like this. There's a very small chance it's going to be reversible.
Right.
So the testing is all geared toward 85%. If we identify that you're below the 85%, then we would talk about what kind of program we can provide you, what we can do to help you. If I don't believe I can help you, if I don't believe that this is right for you, I won't even offer your program.
Right.
I'll shake your hand. I used to give everybody a hug before COVID. Now we have to be careful because Newsom just said no more hugging. So that's the bottom line. We're going to do some specialized testing. We're looking for 85% or less. If we believe, if we're 85% or less, we really believe our program will help. We'll provide you an opportunity to get involved in our program. We don't take everyone because we don't believe that we can help everybody.
Right, but if you are in that place that we can, so the first step
Testing.
is literally calling us. This is not blood work. This is coming in and actually doing
A test.
a 16-point test. That would be the first step. And then
We go
like
from
Dr.
there.
Rappy said, yeah, if we're able to help you, our program, like everything that we do here, is fairly comprehensive, and we do different things. Do just a few points of some of the things that we address.
Well, we want to address your neuropathy from multiple directions or angles. We want to look at nutrition. We want to look at supplementation. We have some technologically advanced equipment that we're going to use to stimulate the nerves and regenerate, rejuvenate, and revitalize the nerves.
Right.
We're going to go through this process of really helping you get better. And that's why our success rate is so high. So we're not doing one thing. We're coming at it from multiple angles. And again, that's why our success rate is high. We pick the right people, and we provide multiple avenues for them to get better.
Exactly. That's exactly it. So yeah, that's a little bit about our process. We really wanted to come on here, educate you a little bit, because you may have that tingling sensation and not even know if you have neuropathy. I really recommend for anybody local, these are local programs. So unlike our wellness program that we can do it remotely, this you do have to come into the office because he does the exam on your feet. The other piece too, if you don't know if you have neuropathy or any of that, and you have the tingling, you have the numbness, you have any of that, you'll want to come in, and I'm going to give like a little peek into next week. We're actually talking about our high-powered laser and our spinal decompression. Reason why I'm bringing it up is a great thing is we can identify it. Maybe it's not neuropathy. Maybe it's coming from your back. And
Correct.
so luckily, you're in the right place because we can help you with that too. And next week we'll be doing a deep dive into our high-powered laser and spinal decompression treatments.
Right.
So
a fair percentage of people that have come to see me over the years, after doing the exams and whatnot, I've identified that the contributing factor is usually, in that case, is from their back. So then we do a deep dive into their spinal condition, what's going on. They have compressed discs, spinal stenosis, sciatica, and then we would address that rather than approach it from a neuropathy standpoint. So it's all about trying to identify what's really the underlying cause of your symptom. That's the bottom line.
Right, and we have different approaches. And so I just thought about this. When people come in and if they have it in both of their feet versus just one. So is it usually that when it's in both, it's more of the neuropathy?
It's going to be all about the testing.
The testing,
Yeah.
okay.
So don't hear, if you have it in both feet and only in one, don't hear that. It's, if you got numbness, it doesn't matter.
It
1
doesn't.
foot, 2 toes, 4 toes,
Right, you
doesn't
want-
matter. At least get it evaluated.
Right. So exactly. You don't have to have it in both. You can have it just in one. And very often we find that it's in both, but just one is a little more advanced than
Correct.
the other. So you definitely you don't want to let this go because it's something that's progressive, almost like
Very debilitating.
any of the things that we talk about.
Yes.
They get worse.
It's insidious. It's the silence, and then all of a sudden it's there constantly, and it can really alter your life. It can change a lot of things in your life.
Yeah.
Think about it. If you can't walk, how would that change your life? I mean, that's incredible. We walk all the time. So
Yes. Yeah, and those falls are really scary too, because
Terrible.
that just creates, especially as we get older, and the possibility of breaking hips and all that. We see a lot of that.
Yes.
So that was our little blurb about neuropathy. I hope that was interesting. Thank you, Nicole, for saying that feedback. Like I said, next week is all about, what do I have that called?
spinal decompression.
Yes, spinal, but
High-powered laser and spinal decompressions next week.
right, and it's called Have You Tried Drugs and Epidurals and Now Your Doctor Recommends Surgery? So we're going to talk about our laser and decompression and see if that's a solution for
And
you.
I can't tell you how many times, and we'll get to this next week, but how many times over the last 32 years that somebody was scheduled for surgery and said, let me try this first. And they were able to eliminate having surgery. So it does happen. And so we want to make sure that everybody has an opportunity rather than just jump right into the back surgery. So that'll be a whole discussion next week. It's very exciting stuff. Cutting edge.
Yes, it is. Very exciting. And again, I'm so grateful for everybody. We're both really grateful for everybody that's joined us live. And for those of you that are watching this recorded, I hope that it was helpful. Again, if you know anybody experiencing any of this, please contact us. This is really important. The exam is really simple, and yeah, let's get you on this schedule and get you.
Go USA. Get your Olympics on. Let's watch.
Yes, yeah, absolutely. Loving the Olympics when I can find them on the TV. So, all right, thank you.
Thanks, guys.
Again, I hope everybody has a great afternoon, a great weekend, and we're going to see you next Tuesday.
Next Tuesday.
At 4:30. Share this information with your friends and family. And yeah, thanks again for joining us. Have a great evening. Bye, everybody.